Thank you so much for tuning in. We are really excited to have this conversation about PCOS specifically. If you have questions that pop up as we're chatting, you should be able to add them in the chat. We have our team kind of looking through, and we'll try to pepper them in if we can. We'll try to save some time at the end too if we can. So we'll do our best to get those in there. So thanks so much. Feel free to add those as we chat. My name is Elise Ash. I'll be the moderator for this panel. My background is as a fertility warrior myself and someone who hasn't had PCOS specifically, but I know a lot of people who have, and I know how much havoc it can wreak physically and emotionally as well, especially as you're trying to get a diagnosis and get everything figured out and under control. It can bring up a lot of questions. So I'm really excited and honored to be here today. The structure of this panel, I will introduce all of our guests. I'm so excited to have this amazing array of women who are so educated on this subject, know so much about it. Each individual woman brings a distinct lens, and I'm excited to kind of focus on these different areas as we get into it. So I'll go ahead and give some brief intros, and then we'll go ahead and get started. Again, feel free to add any questions you might have in the chat. So thanks so much for being here, everyone. So first up, we have Dr. Lucky Seekin, who is a reproductive endocrinology and infertility specialist and OBGYN at RMA of New York. She's passionate about raising awareness about PCOS, as professionally it compromises a large proportion of her practice, and personally she has experienced it herself. Her goal is to educate women about how their bodies work so they can harness this information to take control of their reproductive health. Outside of the office, Dr. Seekin is an avid chess player, enjoys baking, and is making the most of outdoor dining while she can. So thank you so much, Dr. Seekin, and for having this great idea too to have this panel. This is so great.
Thanks for having me.
Next up, we have Megan Pearson, who is the proud founder and executive director of PCOS Awareness Association, the world's largest nonprofit organization dedicated to polycystic ovarian syndrome. She has made it a life mission to be dedicated to fighting for those with PCOS. When she's not focused on her career and volunteer work, Megan enjoys taking classes on topics of interest, horseback riding, networking, and discovering new places. Thank you so much for being here, Megan.
Thank you.
Next, we have Dara Godfrey, who is a registered dietitian at RMA of New York. After being a patient herself at RMA, struggling with PCOS, and ultimately conceiving 2 children via IVF, she knew her passion was working in women's health and fertility. Over 10 years later, her lifestyle-driven approach has helped support hundreds of patients' nutritional goals at every stage of infertility treatment and pregnancy. In her spare time, Dara enjoys cooking, playing the piano, and more recently, playing mahjong with her friends and family. Thank you, Dara.
Hi, everyone. Thank you.
Everyone has such eclectic interests. I'm so boring. I feel like my interests are rage scrolling on Instagram and a bunch of other things as well. So you all are so interesting. Rina Gower is our final panelist. Thanks, Rina, for being here. She is a licensed clinical social worker at RMA of New York. After being diagnosed with PCOS and undergoing fertility treatment to conceive her daughter, Rina shifted her professional career to focus solely on working with others struggling with infertility. Rina is passionate about patient advocacy and the health and wellness space and believes in empowering her patients. She's proud to serve as a state advocate for Resolve and is also a co-host of the podcast Fertility Forward with her colleague, Dara. In her spare time, Rina loves anything active and spending time with her daughter. So this is our fabulous panel. Thank you so much, everyone, for being here. I think the way that we'll start is we'll kind of begin at the top, and I'm gonna ask Dr. Seekin for some information here first about what is PCOS, what is the definition, and how common is it?
So PCOS is, ubiquitous. It's everywhere. People are always talking about it. But what it actually stems from most commonly is disordered ovulation. I don't really think of it as a disease, more like an alternate state of being. There's people that ovulate regularly, and then there's some people that don't ovulate regularly or they don't ovulate at all. And there's so many different reasons why ovulation can be interrupted. So I think it's important before we talk specifically about PCOS to just really understand what is needed to ovulate normally. You're really working with the master gland in your brain called the pituitary gland, and it sends signals to the ovary. And every month, a certain number of your eggs are in play or in the cycle. They get pulled to the surface of the ovary, and your brain sends out signals And the first one that responds to the signal, think of it like a lottery, becomes the one that's selected to ovulate, to grow, mature, and then eventually ovulate. There's also another signal that's sent out to make that ovulation step happen. So I always explain to my patients that PCOS is kind of like a game of broken telephone. There's signals, and if the signals aren't being transmitted properly at the level of the ovary, that is basically what PCOS is. And I think this analogy is really good because no two PCOS patients look the same, right? That's what makes it so confusing, is that people tend to talk, to their peers, their friends, and they'll say, but I have PCOS too, but I have this host of symptoms, and how come you don't? And I think part of that is because there's so many different signals that have to happen inside the ovary itself to cause ovulation to occur. And you could have a defect or a blockage at any one of those given signals, and that might determine the type of PCOS that you have and the type of signs or symptoms that you're dealing with. So it's basically a blockage at the level of the ovary. Some people don't ovulate for other reasons, like the signals aren't being sent from the brain at all. If you're underweight or have an energy deficit, sometimes thyroid disorders, other types of problems where there's a small benign tumor in the pituitary. Those are other reasons, but they're not PCOS. PCOS is really about the signals are there, they're just not being transmitted. It's super common. The statistic that is often quoted is that 1 in 10 women are affected. I think it's way more than that. I think one of the reasons why it's so under-recognized and not called out as often is that so many of us are contracepting for years, 10 to 20 years. So you don't really know your true cycle. And just because you used to ovulate regularly when you were a teenager, and then maybe went on the pill at age 18 and have been on it ever since, doesn't mean that that pattern still holds, because you can have an underlying tendency towards having signaling problems in your ovary and not ovulating, but they only really get kicked off because of things that happen with your biology and your body as you get older, as you maybe go through puberty and gain a little bit of weight, and things can change with your metabolism. And that brings me to my next point. PCOS isn't just about ovulation. It's also kind of mysterious because there's these other seemingly unrelated issues like your metabolism, sugar control, but then also where does the excess hair growth and androgen or excess male hormone come from? And they're all linked, even though they seem completely unrelated. The bottom line is that for whatever reason, women with PCOS tend to have problems with, the way their body handles sugar. And so their insulin levels go up. Their body is desensitized to the insulin and doesn't respond. So the insulin levels go up even higher. And insulin actually binds receptors in the ovary and makes the ovary churn out testosterone and androgens, male type hormone. So that's kind of one of the links and one of the reasons why you'll see those three things go hand in hand. Ovulation problems with metabolism and diabetes, and having, excess hair or acne and things like that.
So Dr. Seekin, you kind of just spoke to this a little bit, but I'm wondering if you can elaborate a little bit more. How do people know if they have PCOS?
So that's another area of confusion because there's different diagnostic criteria. That's what we as doctors use, right? And everyone wants to go through their checklist and say, okay, you meet 2 out of 3 of these diagnostic criteria, so you have PCOS. But like I said, some people are using something called the Rotterdam criteria. That's the most commonly used, and it's the most inclusive. You only have to have 2 out of 3 of the following. Polycystic ovaries, what that means is basically the follicles, which are fluid-filled spaces that have an egg floating inside of it. They're peripherally located and they're clustered, and there's lots of them in the ovaries. So your ovaries look a certain way on the ultrasound. So that's one potential finding. Another is having irregular periods, which is the most obvious sign that you're ovulating irregularly, or if you're not getting a period, you're not ovulating at all. And then the third thing is having signs of excess androgens, hormones like testosterone. So either balding here at the forehead, having excess hair growth where it traditionally shouldn't be. in a woman, and having acne. That's another sign. And you only have to have 2 out of the 3. There's another set of diagnostic criteria where you have to have all 3. And so if someone's using that, you might not be as easily ruled in for PCOS, whereas another doctor might say, hey, that's PCOS. So, you know, that's that's what the diagnosis is based on. So your suspicions should be based on some of those features. And also I should mention, sorry, you have to rule out other things because there are some tricky other disorders which can mimic the way PCOS looks. So making sure there isn't another reason why someone has signs of excess testosterone, like, you know, a tumor in the ovary that produces testosterone or a tumor in the adrenal gland. Sometimes having thyroid dysfunction can look like PCOS because it's associated with weight gain and irregular cycles. So you have to rule out all those other things as well.
We had a question come in, Dr. Segan, that said, can you get PCOS due to contraception pills?
No.
Okay.
It cannot cause PCOS. The reason why that's a question is because sometimes being on long-term birth control pills or using forms of contraception like the Depo-Provera injection can have lingering effects, and it can lead to having delayed return to ovulation and, you know, someone with cycles that are not regular. But that's not because of PCOS, which is an underlying metabolic issue. That's because of something else, but they just look similar due to the irregular cycles.
Great, thanks. Megan, I have a question for you. Why do you think it's important to increase awareness for women with PCOS, and why is this so important?
Absolutely. Just as Dr. Lucky said, like, it doesn't manifest itself the same in everybody. Therefore, you know, like I myself wasn't formally diagnosed until 16, and through the process of age 9 through 16, I was shuffled to and from medical professionals by my mom. She just knew something was wrong. And by the time I was formally diagnosed at 16, I was also diagnosed with cervical cancer. So I feel like people with PCOS, it's very important for them to get diagnosed. Even if that diagnosis is just like a relief, like, I'm not crazy, there is something wrong, and now I can do something about it. So that portion, but then also just treating their health in general. Women's health is so important and underlooked, unfortunately. So it's just so important to have the awareness about PCOS and know that there is something else out there. Because like, I was told that I was crazy. I was told that I just needed to lose weight. I was told that it was puberty and there was nothing wrong with me. And if it wasn't for, you know, my mother being my advocate, I probably would be, you know, have even worse issues than I have now. So it's just important to be aware of PCOS and get diagnosed if you believe you have it. Be your own advocate to get diagnosed.
Thank you. Thanks for sharing that, Megan. It is so important. Dr. Segan, going back to how PCOS can affect infertility or affect your fertility, how does PCOS specifically hinder fertility? Why is there a connection there?
So I wanted to jump in and say I so agree with everything that Megan just said. And I think early recognition is particularly important because women with PCOS who have irregular cycles or don't get a period at all really need to get that education about why this is happening to their body and what it means. I've had patients who come to me with PCOS and they never really got to the bottom of what it was. And they say, I've been trying to get pregnant with my partner for a year. And, you know, I hate to say it, but that was wasted time. And, you know, if they had irregular cycles or they weren't getting cycles at all, they just weren't aware that having that irregular ovulation was going to make it so challenging. And I think patients who know in advance that they're not ovulating at all or they're ovulating really infrequently would really benefit from knowing that information as soon as possible so they can get plugged in with the proper resources, see a fertility doctor. I have women come to me for reproductive checkups all the time, and I tell them, okay, you're not ready to try to conceive now, but these are the steps you need to take when you are, and then at least they're armed with that information. The issue is, first and foremost, you're not ovulating regularly, and regular ovulation or predictable ovulation is really important because human reproduction is super inefficient. And one of the first points of inefficiency is the fact that there's such a narrow window of opportunity. And so it pays to really understand when you're ovulating, because that egg, once it's released in your fallopian tube, is only going to survive for about 12 to 24 hours. And then it disintegrates, and you have to wait an entire next cycle. And that cycle for you, if you have PCOS, might be 90 days from now. That's not acceptable, right? And every attempt, even if you manage to somehow magically get the timing down, every attempt is so low yield because not every egg fertilizes, not every fertilized egg turns into an embryo that's healthy and implants. So it's really not fair if you don't get the same number of chances as someone who gets a period every 28 days does. And so that's the number one cause of infertility and delayed time to conception in women with PCOS. But beyond that, and Dara's going to talk about this, right? If there are other issues, particularly metabolic issues like excess weight gain, diabetes, high blood pressure, all of that can lead to a very unhealthy environment that isn't conducive to easily conceiving. So there's multiple avenues with which PCOS can hinder your fertility. Obviously, ovulation is the number one, but it's not just that, it's the whole picture.
Thank you. What are the treatments for PCOS? What are some risks to know about, possible outcomes that you might expect?
So the mainstay of treatment, I like to start with the simple things first. There are ways to take control of your fertility beyond the fertility clinic, right? And again, Dara's going to talk about this, but there are many studies that show losing at least 5% of your body weight can help to restore normal ovulation, or at least make your cycles more regular, or even make you more responsive to some of the treatments I'm going to talk about. So I think lifestyle changes first and foremost, which we're going to talk a lot about today. In terms of medications, oral pills, which are going to help to induce ovulation, things like Clomid or Letrozole or Femara. These work in different ways, but the overall effect is the same. It's to fool your brain into thinking, oh my gosh, there's no estrogen. And so your pituitary gland cranks out more of that signal. And hopefully, if there's a stronger signal coming from your pituitary gland, it can overcome that broken telephone and overcome some of those blockages in the ovary. It tends to work really well. Some expected outcomes are, hopefully it works, and you come in after taking the medication for 5 days, and we see on the ultrasound that you responded and you're ready to ovulate. That would be great. If you don't respond, because that sometimes can happen, we can often then and there increase the dose and give you another course. That's called stair stepping. And so your ovaries might just need a stronger push to get that desired response. Sometimes, this is rare, but in patients with really severe cases of PCOS, they may not respond at all. And in that case, we might revert to using stronger medications, like giving injections, which basically are the signal your pituitary gland sends. We're just replacing it and giving it at a higher dose. At that point, I tend to start talking about IVF, because those are the same medications you take in IVF. And at least with IVF, you're not as worried about the risk of twins, right? So the risk of twins is there because even though, this is the solution to making sure that you ovulate, sometimes it works too well. And, that signal that's stronger from your pituitary is going to result in you releasing 2 or 3 eggs. And most of the time that's okay, but in 3 to 8% of cases, you may end up with multiple pregnancies, such as twins. That's, to me, an acceptable risk and not the most likely thing to happen. But with the injectable medications, that risk is higher. So it's always something to talk to your doctor about. Is
there a link between PCOS and egg quality or miscarriage?
So that's, not clear cut. I think it's something that's shrouded in a lot of controversy because, you can't measure someone's egg quality directly. There's no test. The way we think of egg quality is really, what we're talking about is the genetics of the egg and the genetics of the embryo. There's many ways to think about quality, but that's what we're talking about. And, we do IVF on a fair number of patients with PCOS. And nowadays there's a lot of genetic testing of embryos that can be done. And I can tell you that in my experience and in a lot of studies that are out there, we don't see a higher incidence of embryos being abnormal from women with PCOS. I think the link between PCOS and poor egg quality comes from the fact that some people say, okay, there might be a higher risk of miscarriage in PCOS patients, and maybe that's due to egg quality. But I think it's a really messy relationship. Women with PCOS are at increased risk of having other factors that are linked to miscarriage, like obesity, right? And other underlying chronic health conditions. So I don't think there's a clear-cut relationship. I don't think if you've been diagnosed with PCOS, that means you definitely have poor egg quality. And I think that egg quality is a very individual characteristic, and it depends on other factors such as age and your biologic makeup.
One more question for Dr. Lucky, and then we'll kind of focus on some of the nutritional angles. But Dr. Lucky, I'm curious too, what does PCOS mean for a woman's long-term health? What does it look like for all the other areas for her life beyond fertility?
Yeah, that's so important. So although my focus is, how to get someone pregnant and make them ovulate more regularly, I always make sure I spend a good chunk of time educating and talking about long-term health conditions to look out for. In the immediate term, if a woman comes to me and says, I never get a period, I'm not just sitting there focused on, okay, what does that mean for their fertility? I'm concerned about the health of their uterine lining, because the fact is that your body is supposed to have a balance of estrogen and progesterone. Estrogen is always being kind of pumped out from the ovary, but the progesterone only comes after ovulation. So if you're someone that's never ovulating or ovulating very seldom, you're not getting enough of that progesterone to balance out the estrogen. And that can cause the lining of your uterus to thicken and transform its cells into precancerous cells, or worse, you could have uterine cancer. And so the cases of endometrial or uterine cancer that I've seen in younger women have all been in the setting of PCOS and exposure to unopposed estrogen for prolonged periods of time. So even if you're not trying to get pregnant and you just come to me for a reproductive checkup, I'm going to suggest, if you don't have periods at all, or you get them very infrequently, we should probably biopsy the lining of your uterus to make sure that transformation hasn't already occurred. And to prevent it from happening, I'm going to, at the very least, recommend that you take cyclic progesterone at least once every 90 days to shed your lining, or birth control, which is a great solution because, it's going to give you some progesterone throughout the cycle.
Great. Thank you so much for that. Yes.
Oh, I was just going to say other chronic health conditions to look out for, and Dara will talk about this more. Women with PCOS are at increased risk of high blood pressure, high cholesterol, and diabetes. So those are things that they should always be getting checked with their primary care doctor.
And that's a good question. We got a question that came up that asked, are high cholesterol and LDL signs of PCOS?
It's not a diagnostic criteria, but it does commonly run with PCOS.
Okay. Thank you for that. So Dara, some questions for you now as a dietitian. How can lifestyle changes restore ovulation and help women conceive?
Well, just as Dr. Seacon had mentioned, that a 5% weight loss reduction in your body weight can make huge changes in your body in terms of helping with ovulation, helping with your menstrual cycle, and ultimately helping with fertility. So both a combination of diet and exercise is really paramount. But it goes back to, I know she mentioned, Dr. Seacon mentioned, goes back to the role of insulin resistance. And that's predominantly what I speak to with my patients, is trying to overcome that through the diet and through exercise. And that's all about blood sugar stabilization. So in terms of healthy eating habits, I always go back to the fact that it's important to stabilize your blood sugar levels, because that has a direct impact in terms of insulin secretion, insulin utilization, and also can help prevent unwanted or unnecessary weight gain, which can happen when your insulin levels are too high in your body, in your blood. So it doesn't mean that you shouldn't be eating carbohydrates. And I want to get that out of the way because I feel like so many of my patients, when they first speak to me about PCOS, they think, oh my gosh, I'm going to have to cut out carbohydrates. And I always like to reassure them that that is not the case. For me, it's about three things when it comes to carbohydrates. It's about choosing the quality carbohydrates. It's about the quantity, the amount of carbohydrates that we're choosing, that we're going for, and also about the timing of the day. So our bodies are much more sensitive to the carbohydrates that we consume first thing in the morning and end of the day. So those are the three things. And then overall, the importance of pairing your carbohydrates with a good quality protein. And again, that helps prevent those blood sugar spikes and drops. That I kind of use the analogy of a mountain. We want to prevent that really steep mountain of blood sugars that can drop really sharply and create that cycle of carbohydrate craving with the addition of proteins that can really help prevent that sugar spike and drop and give you a much longer, wider blood sugar mountain that can keep you satiated and keep your body happy.
So what does the ideal diet look like for PCOS? Like dream case scenario.
People don't like hearing this, but I don't think there is a dream case diet. I don't like the term diet because it implies something very restrictive. I'm all about customization depending on the symptoms that you're expressed with, whether you're coming in for weight loss. But the one common thread that I do like to discuss is the idea of blood sugar stability. So, but I do like to talk about the things that you should be including in your diet. Going for good quality fats, going for high quality proteins. When you are going for carbohydrates, choosing more complex and high fiber carbohydrates over the more simple or quick acting carbohydrates, pairing them with a protein, and then also the importance of hydration. So I like to look at the big picture and also seeing where patients are at that moment, what their current lifestyle is, and slowly changing it and seeing how they react. And it's, you know, great to have a baseline of your blood sugars over the 3-month period, which is your hemoglobin A1C, to see kind of how your body's processing those sugars. If they are on the higher end, it's great 3 months later after modifying one's diet and going for good quality carbohydrates, in the right amounts that work for you, in the right timing that works for you, and seeing if your blood sugars after those 3 months have changed.
Are there specific diets that can help with specific aspects of PCOS, like acne or excess hair or abdominal weight gain?
Well, especially I can touch upon acne. Anything where we manifest in the skin, it can actually manifest internally too. I think of choosing foods that are anti-inflammatory because usually the signs of acne and things like that go back to inflammation in our body. So foods that can help decrease inflammation goes back to healthy fats. So salmon and avocado, nuts and seeds. But I still go back to what creates more inflammation is those refined or processed carbohydrates, those packaged cookies and cakes. And on the flip side, choosing more complex carbohydrates. So that means your quinoa, your whole grains, your beans, your legumes, and then even increasing fiber is important. So fiber can come from chia seeds, flax seeds, bran, oatmeal. And the importance of pairing any of those carbohydrates with protein that can hopefully help lower that inflammation and hopefully decrease some of those symptoms.
Dara, I have a question.
Yeah.
Sorry.
Yep.
Sure.
Someone asked this in the chat, and I was really curious about this too. And you threw out some really good examples of good, healthy fats. Can you give some good examples of high quality carbs versus low quality? You might have already touched on this.
Yeah. So the carbohydrates that raise your blood sugars really quickly. Another way of saying it is high glycemic carbohydrates. Those are the quick acting. That could be white rice, the things that we would think about that are somewhat less nutritious. The white rice, the white sugars, the white breads, but even hidden things like honey or maple syrup that, although they're natural, the way they raise your blood sugar are very similar to the white sugar, the brown sugar, the white flour. So those don't have to be cut out from your diet, but you know, in terms of having them on a daily basis, perhaps you want to swap some of those out, or the majority of them, with more of the complex carbs, the higher quality, the lower glycemic carbs, so they won't raise your blood sugars as fast. And that includes whole grains, the starchy vegetables like sweet potatoes or corn or peas. They are much better quality. They give you a lot of vitamins and minerals. But with those foods, it's still the quantity. So I typically use the example of fist. A half a cup is a serving size of those complex carbs. And even though they may be better quality than those refined carbs, they should still be paired with a protein to really help prevent that blood sugar spike and drop that can lead to weight gain and to that blood sugar instability.
Can you speak really quickly, Dara, to exercise and what types of exercise you think might be most efficient for managing some of the symptoms of PCOS?
So people ask me that question all the time. And it's interesting, most of my PCOS patients, when they first come to see me, are struggling with their weight. And when I look at their exercise routine, I often see that very high intensity, very high cardio type of workout. And I always, like to work with what people are comfortable doing, but I do like to stress that weight training, strength training is equally as important as cardio. And too much of any exercise, but specifically too much high intensity exercise may actually work against people because it can create more of that inflammation in their body. Also can create more sugar cravings. So kind of that combination of a little bit of low impact cardio and then definitely getting some of that strength training, weight training. I love, yoga, Pilates, walking, gardening, sprinkled in with a little bit of the cardio. I've seen at least the most benefits with my patients.
Are there any supplements that you should be thinking about taking as well?
I always think getting blood work first is important. I always look at food first as the medicine, more so than supplements as the first line. But the main thing I recommend is a good quality prenatal vitamin that has at least 1,000 to 2,000 IUs of vitamin D, especially if you're living on the East Coast where the sun isn't that strong, and especially during COVID where no one's really going outside as much. So prenatal vitamin that has vitamin D, and also DHA, which is the best absorbable form of omega-3 fatty acids. Those are my baselines, and then it really depends on a patient's blood work and where their baseline is.
Oh my gosh, there are so many good questions coming in. I'm getting overwhelmed, like reading them, trying to get them in, but I also want to keep moving because we have so many other things to talk about. So Rina, I want to kind of move on to some of the mental health components that can pop up when we're talking about PCOS. What is the link between PCOS and depression and anxiety? And is there one there?
Sure. So I think this is really important. The kind of third important piece for people to understand. And I saw already a question in the chat where somebody said, is it possible to have psychological symptoms from PCOS and unbalanced hormones? So the answer is people with PCOS are 3 times more likely to have depression and anxiety. Unfortunately, there haven't been enough really studies done yet to prove what that link is. Is it because of your hormones? We don't really know, but we do know that people with PCOS are more likely to have depression, anxiety, and then also OCD, bipolar, or bulimia. So it could be from a lot of factors. So one certainly could be the hormones. It could be something to do with your neurotransmitters. And also a lot of studies are showing that there's a really big link between body image and depression and anxiety. So as both Dr. Sikhan and Dara, touched upon, some of the major symptoms of PCOS are having to do with our bodies. So obesity, acne, facial hair, excess body hair. Now those things make people feel really uncomfortable. And so there is a link to show that obesity and depression are linked. So a big thing with PCOS could be, they say that it could be perhaps a link between body image and sense of self and depression and anxiety. Studies have shown that there is a cultural component to this. So in societies where being thin is not necessarily seen as beautiful, there actually is less of a link between the depression and anxiety and PCOS. So I think, another thing to point out is commonly, a lot of times people are diagnosed with PCOS right around the time when you may be starting to date and to be aware of what you look like. And so it may often make people feel really uncomfortable. And then, self-esteem can be tied into that. So there's all sorts of factors, but I think kind of the overall important takeaway is, yes, there is definitely, it is important to note that there are psychological symptoms that can be associated with PCOS. And it's really, really important to seek help and don't think that this is normal and that you have to suffer alone in this and that you are alone in this, because you're not. And there is so many ways you can get help. And, as Dara touched upon, there's a really big link between eating healthy and exercise and helping with depression and anxiety. So of all the studies, they all say that really the best way to manage this is through a combination of exercise and eating correctly. And that can make a really big difference in managing anxiety and depression. Then, of course, if that's not enough, you can also seek medical help and, consider medication to manage that as well. So sometimes it can be a combination of a lot of different pieces to put together to be the one that's the right thing for you.
Are there any additional resources or coping techniques that you recommend for people who might be navigating depression, anxiety, and PCOS?
Sure. So something that's really helpful, especially for those with PCOS, is mindfulness. So I always talk with my patients about the importance of mindfulness, and I bring a lot of tenets of positive psychology into my own practice. So the 5 basic tenets of positive psychology are gratitudes. So that's the act of practicing gratitude every day. So I always say it's a really great way to start your way and end your day by thinking of things that you're grateful for. They don't need to be deep existential things. They can just be, I'm really grateful for this awesome cup of coffee I'm having, or I'm so grateful that I was able to go outside today. So that's one that's really important. Random acts of love and kindness is really important. So that could be smiling at somebody, holding the door for someone, whatever that is, getting you kind of outside yourself and doing something for somebody else. Journaling is really important because that's a way for you to kind of sit and get centered and write out what you're feeling. Maybe that takes you 5 minutes. Maybe it takes you 30 minutes. There's no right or wrong way to journal. People always ask, oh, do I need to purchase a special journal? No, you can if you want to. You can also text things to yourself. You can email it to yourself. It's whatever works for you, but it's really, what's important for that is it's the act of getting out your feelings and then looking and saying like, oh, wow, I didn't know I was holding all of this in. And if you're working with a therapist, journaling is a really important tool in helping to identify patterns and triggers, which then once you identify those, then you can work to kind of work within those to stop them and help you kind of cope. The other one is exercise is a really important part of positive psychology since it increases endorphins. And then the third is meditation. So meditation, similar to journaling, is great because it's a way to just get centered and breathe. And that's really, really important. I cannot stress that enough, especially with now the addition of the pandemic. So some apps that are great for meditation are Headspace is really good. Calm is great. Stop, Breathe, and Think is great. There's so many out there, but I just encourage you to try that and find a practice that works for you. And again, with all of these things, it's what works for you. There's no right or wrong. It's figuring out, okay, here are the suggestions and this is how they adapt and fit into my life. But mindfulness is a really, really key component of helping to manage anxiety. So I really encourage people to try and adopt some sort of mindfulness practice into their lives to help manage it.
Thanks, Rina. I'm so glad you added that part at the end about like finding what's right for you. I feel like that's the caveat with a lot of this stuff. And when you're looking at tips and best, cleanest, this thing, like obviously listen to medical professionals, but also interpret what you need as a person and know that that could change. There's no right or wrong way to journal. There's no right or wrong way to process what's going on. Just try new things, see what works. And it might change over time. Something that feels good one day might not feel good another day. So give yourself grace. We're all doing the best that we can right now. Caveat. Okay. So Megan, hoping to talk a little bit more now about your advocacy work. And I'm curious to know what prompted you to start PCOS Awareness Association.
Yeah, myself.
Yes.
It's funny because my friends and family always say that I've like been selfless in it, but in all actuality, it's very, very selfish.
I feel like I created what I needed. I mean, what you created, exactly. What you needed, you saw a need.
100%. So like I was saying, you know, I wasn't formally diagnosed till 16, but then getting older, I was actually taken to the ER because some of my cysts ruptured, and being in the ER, they were like, you have PCOS, there's nothing we can do for you. Like, you just have to live through this. This is your life. And it was that moment that my mother said, I see something in your eyes. Like, don't do anything crazy. Too late. So my family and friends I'm close with my family very much. And so, you know, hearing through the grapevine, they kept hearing that something was going on with me and they were wondering what was happening. So I kept saying, you know, PCOS, and they were like, what's that? I don't even know what that is. So I actually started making like these little bracelets. I found out that the color was teal, and I started making handmade bracelets for each of them and giving them and kind of explaining like what I was going through. And in that, like, that was when Facebook started like really becoming popular, and some of my family members kept posting their pictures on Facebook, and next thing I knew, I had messages from all over the world asking me, hey, I have PCOS, what is that bracelet? I need it in my life. And that's when I was like, oh, it's not just me. I'm not alone. Like, there's others that are dealing with the same situation, and we all are looking for kind of like a support system. So that's when PCOS Awareness Association was born, and we are built on a few pillars of advocacy, information, support, resources, and just recently we started helping to fund the research of PCOS by Lujan Labs, which is a division of Cornell University. So we're you know, trying to encompass everything. And just to touch, I just wanted to add in, so Rina was talking about, you know, mental health and whatnot. And so if you get past that point of no return, hopefully there's a return, we do have a resource that is, if you text PCOS to 741-741, you will get the crisis text line, and they will help you in any situation that you are in that you feel that you cannot handle.
Wow.
That's awesome. That's awesome. Are there any other additional resources or initiatives that you recommend, Megan, for women kind of going through this, especially at the beginning stages of the diagnosis?
Yeah, absolutely. So when I first envisioned PCOS Awareness Association, I wanted something similar to Facebook. I wanted some like a social media aspect. But of course, at the time when I was just starting out, I was reaching out to app designers, and they were like, you know, frantically scribbling down all my needs and wants. And then at the end, they were like, okay, that'll be $200,000. And I'm like, ooh, back it up. I don't have that. So I kind of like, I'm big into the idea of let's not reinvent the wheel. So I actually had went out and found, it's called My Health Teams. And they have social media platforms for like a bunch of different diseases, cancers, disorders, and whatnot. And I reached out to them because I didn't have a PCOS one. And I reached out to them, and the founder, she actually responded directly to me and was like, thank goodness. And I was like, what's going on? And she said, I have PCOS and I have not been able to start my PCOS health team because her board thought it was a conflict of interest for her. So they actually started a My PCOS team based for us. And it's like, she said within 2 weeks, they had something like 14,000 people on the app alone. So that was like another solidifying the idea, like, let's do this. So it's, if you go to mypcosteam.com, you can join and you can search by zip code, other people with PCOS that are nearby to you, and you can chat. You can, when outside opens, please, when outside opens, you can meet up with them and have coffee and do whatever you, you know, make friends and whatnot. But then we also have, let's see, we have an ambassador program. So we are really trying to, like, when I first started the organization, I was going out to health fairs, hosting little booths at health fairs and whatnot. And so I wanted to kind of grow that idea that people are out there, other people are out there in their city, and they're able to go to a health fair and host a booth and share information about PCOS and all the resources that we have. So we have the ambassador program that does that. We've also teamed up with, there's so many, let's see, Needy Meds, and they offer free, low cost or sliding scale clinics that they have, you know, they've put out the information about PCOS at these clinics because we're finding that a lot of our demographics are low income. So we wanted to have another outlet for them to be able to get the medical support that they needed. And they also offer a free, a free medical prescription drug discount card. I myself have insurance, but I did, you know, I wanted to test it for our followers. And so I tested it without using my insurance. And just at the time I was taking birth control, and it brought it down to like $8 for the birth control. So it's substantial. I suggest everybody go out there to the website. It's our website, which is www.pcosaa.org. And you can find a whole slew of other resources. And we're always adding to, you know, to our list and the things that we're doing.
Thank you. That's so awesome to hear that there are so many different tools and resources and communities. I feel like feeling isolated is such a common theme, or feeling like you're the only one trying to figure it out. So being able to connect with other people and figure out what other people are going through too is just such a great tool. So thanks so much, Megan. Do you have any advice or anything that you want to tell people out there who, you know, might be struggling or trying to navigate, you know, what's going on?
Yeah, absolutely. I think my number one advice is you have to be your own advocate, because if you're not going to, then who will? You have to open your mouth and say what you want, what you need, and go for it. Because again, if you're not going to do it, nobody else will.
I think that all women should be unapologetic about advocating for themselves. I see patients with PCOS all the time that feel that they've been bounced around, you know, from one GYN to the next. And I think it's important to not settle. If you feel like you're just being labeled and you haven't had the appropriate tests and you feel like there might be something else going on with you, listen to your gut. And it's never wrong to seek a second opinion, a third opinion, a fourth opinion until you're satisfied and you feel heard and comfortable.
Totally. Yes, absolutely agree. There are so many great providers out there. And if you don't feel like your needs are being heard or you're not being taken seriously, you deserve a provider and a care team who will help you navigate that for sure.
Yeah,
I'm going to try now. Oh, sorry.
Sorry. I was just going to say, so there's something that my mother always says, again, back to my mother, she's my biggest advocate. She always states, there's a reason why they call it practicing medicine. It's because they're practicing. You don't have all the answers. If Dr. Lucky doesn't have the answers, somebody else might have the answers, but Dr. Lucky does have all the answers. So go to her. So, but yes, it's a practice.
For sure. Okay, so we had a couple of questions pop in. I think all the panelists have been trying to like pop on and answer some of them, but let's just quickly try to get through as many as we can. We had one that came up pretty early that asked, does PCOS ever go away?
So that's why I say I don't think of it as a disease. I think of it as this alternate state of being. I think if you have a tendency towards PCOS-like symptoms or features, that underlying tendency is always going to be there, but it doesn't necessarily always have to show itself. What I mean when I say that is, you know, I have patients who will say, well, you know, I used to exercise all the time. I had a pretty strict, you know, diet, and I was eating a certain way, or I was on a sports team. And then afterwards, something happened in their life where could be that they had a child and they weren't able to get rid of some of that baby weight, and that just became their new weight. And sometimes the weight gain is what I see the most often as kicking off and kind of pushing that person over the edge, where now all of a sudden that's when the period starts spacing out and being irregular. I think sometimes there's changes that we don't really know what to attribute them to, but that's the explanation. This is why people link birth control to PCOS, because they've been on birth control for like a decade. And like I said, there could have just been things that manifested over that period of time. Now they go off of the birth control, which has been masking their PCOS, because birth control might give you a bleed every month, but that's a fake period. That's just you giving yourself hormones and it going away and then causing your lining to shed. So I don't think it ever really goes away, but I think that you can, if it can be easily managed with things like diet, exercise, and you know, lifestyle changes, then if you keep up those changes, it's possible that it'll never rear its head again. But having said that, I feel like it's important for me to mention as a doctor, if you try to make all the dietary changes in the world, exercise regularly, and it's still not fixing your PCOS, do not feel like a failure, because everyone's PCOS is different. And just because this is one of those rare areas of what I do where you can actually make changes and take control of the situation, what I mean by that is, you know, having a low egg count, there's nothing you can do lifestyle wise to change that, right? And we have proof of that. But with PCOS, it is empowering to know that there are changes you can make. But it can also be very disheartening to those patients who make every concerted effort to make those changes and their PCOS doesn't seem to improve. It's not your fault. You're not doing anything wrong. Not everyone has the ability to alter the way their PCOS works, you know, and that's when it's time to kind of partner with your doctor. But I just want there to not be any self-blame. I want people to understand that it's not always possible, but it is encouraging that we know for a fact there is a chance that you can modify your PCOS without medications and just by having a healthy lifestyle.
What specific blood work do you recommend a PCOS patient who's trying to get pregnant get maybe at the beginning?
So I definitely always check someone's ovarian reserve, because you want to always make sure that you know their egg count, not because how many eggs you have makes a difference to your fertility, because every month if you're ovulating or we make you ovulate, the goal is really to ovulate one egg, but it just tells me about options for treatment, because the number of eggs that you have is important for things like IVF and other types of fertility treatment. So that's always a baseline thing that we check. For PCOS specifically though, as I mentioned, part of the diagnosis is ruling out other causes. So we always want to check different levels of androgens. So not just testosterone, but something called DHEAS, which comes from your adrenal gland. Another adrenal androgen called androstenedione. Say that fast 10 times. We also want to check something called 17-hydroxyprogesterone or 17-OHP. Because there's something called congenital adrenal hyperplasia or CAH, which is an enzyme that could be missing in your adrenal gland, and that can mimic PCOS. That's like the grand imitator of PCOS. So if that level of 17-OHP is elevated, then you know it's actually that problem and not PCOS itself. You always want to get a lipid panel. You know, you want to make sure that you know what's going on with cholesterol. I always check a hemoglobin A1C, HbA1c, because that's going to give you an idea of someone's sugar control over the past 3 months. I think someone sent in a question before this event about how do you measure insulin resistance? Because that's like a buzzword we always talk about. Oh, it's one of the features of PCOS. There are really specific ways to measure an insulin level after you give someone a load of glucose or sugar. That's used more in the setting of research, not so much in clinical practice. The most practical thing to do to measure your sugar control is the hemoglobin A1C. And that could sometimes, help to diagnose diabetes in someone who hasn't seen their primary care doctor in a long time. So I always check that. And I always check the pituitary signals, FSH and LH. And I check the signals that are, hormones that result from those signals from the ovary, estrogen and progesterone. So those are some of the tests that I would recommend in the way of blood work. And then obviously a transvaginal ultrasound to really clearly see the ovaries.
Thank you so much. And, thank you to everyone. We're run out of time. So thank you so much to everyone who got their questions in. I hope we got a lot of them. Thank you, Dr. Lucky. Thank you, Dara, Megan, Rina, the whole RMA of New York team. Really appreciate all of it. The event has been recorded and it's going to be posted on RMA's YouTube and I think Instagram TV, maybe too. And if you'd like to make an appointment with Dr. Lucky, Dara, Rina, that's a great way to start through the RMA website. So hit them up, get going on that. Check out the PCOS Association. I totally botched that. Sorry, Megan.
You're fine.
Okay,
I do it too.
Check out Megan, the PCOS Awareness Association, their website, their nonprofit, doing great work. Thank you, everyone, so much. Thanks for letting me be part of this too. Any final words? Oh, yeah.
Honestly, we're so thrilled to have you. And I think your organization, Fruitful Fertility, is amazing. I think having partnership, mentorship is so important to any woman going through this journey. And I think women with PCOS in particular, all the things Rina talked about, I mean, I think that they can really benefit from your services and from, mentorship and just kind of having a group of women that support them.
We're all doing our best out there. So thank you. And thanks to everyone for listening and hopefully learn something and can walk away a little bit more empowered and educated. So thank you.
Thanks. Bye, everyone.
Bye.
Thank you.